Hello, I'm Kim from the Holler Heilpraktikerschule, and today I have the book author and Dorn therapist Olaf Breidenbach as a guest, and we're going to tell you and let you in on the secrets of Dorn therapy.
Yes, I'm Olaf Breidenbach and I'm going to tell you why you should definitely learn Dorn therapy.
This video has been translated from German into English using artificial intelligence. Enjoy the video. Hello Olaf, welcome to our website.
Hello, Kim.
Would you like to introduce yourself? Tell us, who are you?
I am Olaf Breidenbach. I have been a non-medical practitioner for about 25 years. I work exclusively with manual therapies. Dorn therapy, of course. I also started with Dorn therapy. A lot has been added in the meantime, including chiropractic. I work a lot with that, it's also very similar. But also everything else that the manual heart desires.
That's your lifeblood beating there.
That is my lifeblood.
Okay, then why don't you tell us what Dorn therapy is?
Dorn therapy is a gentle, manual method to treat pain and the musculoskeletal system. It can also be used for preventative treatment. And the great thing about Dorn therapy is that it is very, very safe and the ideal method for beginners in particular to enter the world of manual therapies.
Actually, it was one of the first seminars I attended. I can certainly vouch for that. Can you provide us with more information on what makes it special?
Maybe I shall begin with the tale to spice it. The inventor of Dorn therapy is Dorn. Even though we work on the Dorn processes in Dorn therapy, the name actually comes from the inventor. It is a folk medicine, it really comes from the people. It is also for the people. Dorn therapy is a method for ordinary people because they understand it. Dorn was a sawmill owner in the Allgäu region. And he invented it more or less by chance about 50 years ago. And he himself received treatment from a tendon setter or bone breaker, as they are called. And he found it so interesting and so great that he wanted to learn it himself. The human was no longer able to teach him. He then developed it himself from the treatment he had received. And he then simply tried to imitate it. He treated his wife with great success and then treated the whole village. And from the Allgäu, it began its triumphal march through the whole of Germany.
Wider and wider circles.
Further and further.
And there are now several books by Dorn.
He never
Dorn
wrote a book
has.
himself, but he was quite reluctant to be in the public eye. However, he always wrote a foreword or endorsed it by putting his name on it. Dorn himself published the books more as patient guides. Not really instructions on how to do it. Later, other authors came along, including myself, who then wrote for a specialist audience, have described the therapy in more detail.
Right, so you've now told us something about the history and origins of the Dorn method. What exactly happens during a spine treatment?
While spinal treatment mainly focuses on the vertebrae, it also addresses issues in all the other joints. Therefore, the primary source of pain for most individuals is often blockages present in their joints. I'll show you what it looks like on the skeleton. And Dorn therapy is actually similar in philosophy to chiropractic. I'm sure almost everyone has heard of chiropractic somewhere. You go to a doctor or another healer. He gives it a firm tug and then it cracks. And then the blockage is released again, audible through the crack. Dorn therapy does exactly the same thing. The only difference is that it is a little gentler. Gentle does not mean that it doesn't hurt. Gentle simply means that we don't hear this crack. That we don't have any jerky movements. Instead, we release it in the movement. Ultimately, the patient releases their blockages themselves. The therapist only helps them to do so.
Okay, you've just talked about chiropractic and Dorn therapy. There are also various manual therapies. Oh, now it's thundering here. Don't mind me, we'll just keep talking. There are also various other manual therapies. What is so special about Dorn? Or how does it differ from the other methods?
In terms of philosophy, Dorn therapy is very close to chiropractic. Even if many Dorn therapists don't like to hear that. Because both the chiropractor and the Dorn therapist, we assume that if there is a vertebral blockage, i.e. the blockage, or the vertebra presses on the nerve, this causes disorders, muscle tension and direct pain. And when we have resolved this blockage, then the pain also disappears. And also the consequences of it. This is exactly the same as in chiropractic. Osteopathy, for example, also focuses on the fascia, the muscles, trigger points, and so on. The Dorn therapist and the chiropractor simply start from this. The spine is like a fuse box. If there is a vertebral blockage, the fuse is blown. And then the whole circuit behind it is disrupted. When I have released the vertebral blockage, the nerve works properly again. And the other things disappear by themselves.
How permanent is a spinal treatment like this? Do I have to do it regularly? Or is once enough? How should I think about it?
I am unable to respond in this context. It may be that one treatment is enough. Especially in acute cases. If you have an accident, if you've fallen and have a blockage, you've lifted something and realize, oh God, there's something there. Then one treatment is usually enough. You could also discuss whether you undergo chiropractic treatment. For instance, I did something foolish, resulting in a blockage in my spine, and now I urgently require treatment for my entire back. However, most patients who come to a naturopathic practice naturally have chronic problems. And with chronic problems, it can also take a little longer. But the great thing about Dorn therapy is that we notice whether it is working at all during the first treatment. This means that the first treatment is immediately successful. If this is the right method. The beauty of the method is, in the end, we realize in the first treatment whether the method is the right one. In other words, I treat the person when they immediately notice an improvement. Directly doesn't necessarily mean, bang, it's better. But it can be a few hours, it can be a day. And he notices, my symptoms are better. Then we're on the right track. It can come back, there's no question about that. It can take 2 days, it can take 3 days, it can take a week. But we know that the pain the patient has comes from the blockages. That's one thing. We don't need to plan a series of 6 or 10 treatments. Instead, we immediately realize that it's worth continuing. If the symptoms continue to recur regardless, it indicates that solely relying on Dorn is inadequate. It is necessary to examine the reasons behind the recurring blockages. We acknowledge that pain is the underlying cause of these blockages. However, another element must exist. After that, the excitement truly commences. At that point, we can unveil the entire range of possibilities. There is also a possibility that I will refer the patient to an osteopath or another location. But we still help them first. And that's the fair thing.
You just said that we don't just treat specific points, but treat the whole back. Did I understand that correctly?
Exactly. We always treat the entire spine during Dorn therapy. For me, the pelvis and the SI joints are also part of the spine. The temporomandibular joint is also part of the spine. We really treat all the vertebrae. From the pelvis to the temporomandibular joint. You can also treat the entire extremity joints. This is actually part of Dorn therapy. I always check myself to see if there really is something wrong. Yes. That would be all the bones.
You have the skeleton lying next to you, or rather part of the skeleton, namely the spine. Shall we just have a look at it? Do you want to show us exactly what's happening?
The special thing about Dorn therapy is that we always treat the whole spine. For me, the spine also includes the sacrum and the pelvis. Many people have a pelvic obliquity, for example. This is caused by one pelvic blade tilting forwards or backwards. This makes one leg longer or shorter in relation to the other leg. If the pelvis is tilted, the spine has to compensate for this. We have a difference in leg length, the pelvis is crooked. Then we get a blockage somewhere in the spine. The principle is that the eyes must always be straight and parallel. And where this equalization takes place, blockages occur relatively frequently. This means that it may hurt here. If I were to work locally and only treat the area where the pain is coming from, the pelvis would still be misaligned. Then these problems will return relatively quickly. First I have to straighten the pool. Then the position, where the localized pain is. Then I have a good chance that the neck will remain stable. And the patient won't have to come back. What is a vertebral blockage? The explanation given to patients, as explained by Mr. Dorn, is simply a twisting of a vertebra to one side. To one side. This puts stress on the nerve, which can then cause these symptoms. The nerve can initially hurt locally, which is the classic lumbago, immediately at the site. But a nerve like this also supplies other areas. It relatively often causes muscle tension to develop in another area that is supplied by the nerve. And that is the reason for the patient's pain. Eventually, we must realign the vertebra to relieve the pressure on the nerve again, thus restoring it to its correct position. This is how I explain it to the patient. When I explain it to therapists now, this is also a simplified explanation. But each vertebra has 4 joints. 2 downwards, 2 upwards. And in one of these joints, the vertebra gets stuck. This leads to different positions of this vertebra. But in Dorn therapy we only need to feel in which direction the vertebra is pointing. It does not matter whether it is pointing downwards or upwards. But it is important. The vertebra is not simply twisted, but we have a blockage somewhere in the joint.
If you now say that the entire spine is treated in such a treatment, how long does such a treatment take?
It depends on who makes them. I am now very fast. I can do the whole spine in 20 minutes. But with the preliminary consultation, undressing and everything else you do during the treatment, I need about half an hour. Of course, I'm also very fast thanks to my experience. As a beginner, you can calculate 3/4 of an hour.
If we are now treating the whole spine, but there is only a blockage in one place, why is that so important?
First of all, we don't just have blockages in one place. We have a blockage that is responsible for the symptoms. But everyone has blockages all the time. Most blockages disappear by themselves. But I can only feel whether there is a blockage. I don't know whether it's causing hidden symptoms. That's why I first have to palpate the whole spine. Palpate the whole spine. In other words, touch it and see if there are any blockages that the patient doesn't even notice. Not even notice. To do this, I walk along the spine and automatically release muscle tension in the spine. That is the special thing about Dorn therapy. In massage, especially here in the West, you always learn that you have to massage away the spine. But all these small intervertebral muscles, which are also hardened, are automatically massaged in Dorn therapy. This has another special feature when I do a chiropractic treatment. I first release these intervertebral muscles. Then I need much less impulse, much less force in chiropractic. And often I can even do a chiropractic treatment without making a jerky movement. Only because I've worked with Dorn therapy beforehand. That's it.
It's actually a great method in its own right, especially for beginners. Because it's very safe and easy to learn. And if I have more manual techniques afterwards, Dorn therapy complements manual techniques such as chiropractic.
Just like chiropractic, just like any other manual technique. But the nice thing is that Dorn therapy is compatible with all therapies. I can use it with combine homeopathy with phytotherapy. That doesn't interfere. And above all, it supports the other therapies. As I have just said, the patient commonly presents with pain, but may also exhibit additional symptoms. As practitioners of alternative medicine, we are aware of this. The patient is viewed as a whole entity and may have additional issues as well. And often we have started a therapy that is stuck somewhere. We are actually doing the right thing. Of course, it's possible that the nerve is responsible for another organ being affected. Then, of course, the other therapies won't work either. For example, acupuncture or herbal therapy, fungal therapy, whatever. And if I now, when blockages lack obvious symptoms, alternative therapies can provide fast, effective relief. Hence, they are considered compatible due to their prompt action.
Then why don't you tell us who the method is suitable for? Who can learn it?
In theory, anyone can learn it. Dieter Dorn himself was a farmer and sawmill owner. He even invented it, not just learned it. But of course, in Germany only alternative practitioners are actually allowed to use a heart. With restrictions, so are physiotherapists, occupational therapists, and so on.
And who is it for on the other side? So which patients is Dorn therapy suitable for?
Dorn therapy is actually suitable for everyone. My youngest patient was 3 days old. My oldest patient, I didn't manage 100, she was 98 years old. So you can use Dorn therapy with anyone. That's not a problem at all.
And you also give Dorn therapy seminars at our school. Why don't you tell us what you teach in the seminars? How do people come and how do they go home?
Yes, here at the Alternative Practitioner School, I think it's primarily alternative practitioners and candidates for alternative practitioners who come. But as I said, physiotherapists are also very welcome. And you don't need any prior knowledge of manual therapies. So it doesn't really matter whether you do something else or would like to do Dorn therapy as an accompanying therapy. Or if you just want to get a taste of the world of manual therapies. And after the course, anyone will be able to carry out a complete Dorn treatment. And should have immediate success. Perhaps not a 100% success rate. That takes a bit of practice. You have to learn to feel a little. But that's the beauty of Dorn therapy, you can't really do anything wrong. I'm not saying it has no side effects, I'm not allowed to say that. But it takes a lot to go wrong with Dorn therapy.
When I arrived home, I immediately escorted my husband to the couch and attended to his needs. This was not a one-time event, as I have continued to provide care for him and many others since then. I can confidently affirm this without a doubt.
Exactly, the longer you stick with it, the greater your successes will be. And then you've tasted blood anyway, and then you do other things. Because it's ideal, of course, if you add to it. If you have a slightly broader repertoire. But Dorn therapy is the ideal therapy. To enter the world of manual therapy.
Actually perfect for all alternative practitioner candidates.
Or for alternative practitioners who perhaps do other therapies, but realize that everyone comes, no matter what they come for. If they come for their bowels, they come for their eyes. They come because of allergies, but almost everyone has problems somewhere in their neck or there. Or even say. Many patients make the connection themselves, saying, yes, I also have something in my back, can it not be related to that? If you have to send patients away, it's not so nice. Consider exploring Dorn therapy, even if it's just to try it out. If it proves ineffective, you can sense and convey it to the patient. This way, potential complexities can be addressed and assessed accordingly.
I'm definitely looking forward to it. Have we piqued your interest? Then, please take a moment to explore our website. Below, you will locate both the link to our website and the option to register for the seminar. We will also be happy to answer any questions you may have about Dorn therapy. So please feel free to send an email to Olaf or to us. Contact details will be displayed, or you can contact us by phone. We hope to see you soon. See you soon.
Yes, I look forward to seeing you at the seminar and goodbye.